elderly depression actually is a mental and emotional disorders of older people. And then a lot of old people do feel sadness, occasionally feel blue moods. That's considered normal. But for depression, actually it's a lasting feelings of depressed mood. It's happen in elderly people as well. But unfortunately, clinicians, family members, and even patients themselves sometimes overlook these conditions or under-recognize. Some of the patients with dementia, they also present with depressions. But unfortunately, sometimes when they do have depression, also will be underdiagnosed.
Many people have trouble distinguishing between early stage Alzheimer's and also depression. There's a fine silver line in between actually, because some of the symptoms overlap, okay? But they have to recognize that depression is actually also an illness. Old people are generally expected to talk slower, to move slower, to do things slower, you know. In a way, okay, society has deemed them not as capable as they were before. So somehow or rather, this will affect their mentality. You know, they may think that, oh, now I'm old, I'm not going to be as useful as I am when I was young.
Maybe elderly people, they're more prone to depressions. There's few reasons. Always a combination of the factors, they involve the biological factors, sometimes social factors, then also other psychological factors.
Many related to loss in mobility, loss in independency. They used to be independent, but because of physical illness and because the mobility is lost, they could be feeling depressed.
If they are depressed, most of them don't even want to get out from the bed. Okay? They're thinking, what's the point?
Medical scientific wise, the cause of depression is due to like neurotransmitter of the brain. It's a chemical imbalance is causing that. It's inherited. Family history of depression that also contributed to depression in elderlies.
Financial hardship due to retirement. Isolation. Children, family members are away. Also, loss due to death of loved ones. Elderly people sometimes have multiple chronic medical conditions can trigger the depression.
Common symptoms are they're feeling sad. It's not just a sadness, they're feeling depressed for prolonged periods. It could be more than 2 weeks, 3 weeks, like that. And also feelings of purposelessness.
They have no motivation, they do not have mood to do anything, they have lost their interest. Feeling restlessness, they cannot sit still, lie down quietly, feeling restless and just want to move around. Lack of concentration, they cannot concentrate well, they cannot focus so many things. Because of this, they cannot make decisions. Depressed elderly will also present some physical signs and symptoms and physical illness in depression: headache, body ache, chest pain, abdominal pain, and so on.
Of course, other symptoms like sleep problem, sleep disorder, they couldn't sleep well, and change in appetite, some they couldn't eat well. And also, in severe cases, some they even thought of suicide. The typical treatments of the elderly depression involve combination therapy. Treatments with medication or psychotherapy is proven to be effective treating the depression in elderly people. Especially nowadays, we have various forms of antidepressants available in the market, and also very effective for the elderly. The chemical involved serotonin, And some antidepressants involve the noradrenalines, no? But the newer antidepressants are better in terms of the less side effects compared to the older, antidepressant. In order to get patient fully, go into remission or fully recover, you need to treat them for at least, maybe 6 months period, So also that you can prevent the relapse of the illness.
In the real world, while some conditions require medication, there's no shortcut to being our best selves. Hard work and good tools can give you the long-term skills to live your life to the fullest. If you're looking for help, talk to a psychologist. Psychotherapy can help you effectively manage stress, anxiety, and depression. Side effects of psychotherapy may include better health, improved relationships, and higher self-esteem. Do not engage in psychotherapy while pursuing miracle cures that do not exist.
Most importantly, they need social interaction. They need to feel that they are contributing to society, that they are not useless. They must be willing to help themselves first.
Lifestyle changes, we can cover like how to improve your sleep, increase the physical activities, so that you increase the mobility, and also the finding the new hobby.
So that the family will need to participate also in this. They need to reach out to their loved one, and also to help them to communicate, to socialize. With medication and with family support, all depressions can be cured to a certain level. Most of the time, their loved ones are working, maybe they are abroad, so they are not able to care for them. They pass on this responsibility to us, okay? We have maids, medical assistants, staff nurses, and all that around here, okay? Most importantly, in the nursing home, they have a lot of peers their age, which are able to communicate with them, talk with them daily. We just provide an environment where you can communicate with peers. There are people taking care of medication, okay? They can do bathing or sponging for you. They can assist you to the toilet. And then our meals actually cooked by a Chinese chef, and they actually been looked at by a nutritionist before, okay, so that they get all the nutrients in their daily meals. There need to be a balance in the food pyramid, and most importantly, because we have nurses here, in case of any emergency, we are there to help, okay, because we are here running a 24 hours nursing home service.